All right, welcome to the Duke Spine Institute. It is July 18th, 2023, and we are working on our patient who's visiting us from out of state. She is from Texas. The lovely state of Texas. We have a lot of patients from Texas. And she basically is here because she's having problems with her lower back above and below her fusion. She's had a fusion done. You can see the screws and rods. You guys see that shot? You guys see the screws and rods there?
Yes, we do.
So she's fused from L4-5, L5-S1, and she's now got what's called adjacent segment disease above her fusion and below. She has two herniated discs above that are causing horrible pain for her in her back. She has the sacroiliac joints below, which we just treated with the Duke plasma rhizotomy shot. All right. She has watched countless surgeries by us here at Duke Spine. She told me she's my #1 fan, and I believe her. Shot. All right, it's looking pretty good. So far, so good. Now, we've already fixed her SI joint. Dr. Patel did that. A lot of bone spurs here. And it's not uncommon to get so much bone spur from fusion. Fusion promotes bone formation. Not bad. We've lost 2 drops of blood. Keep going. Huh? She got nice foramen, yeah. And her problem is not leg symptoms. She's got big foramen. She's not complaining about leg symptoms. Her complaints are all about back pain, coming from above the fusion with those 2 discs and below with the SI joints, which we've already treated. Feel free to ask questions. Henry, go ahead and run our video on why do herniated discs cause so much back pain? What's the mechanism? Shot?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Right, welcome back. Now you've had an opportunity to see what does cause back pain or how a disc causes back pain, kind of both those answers. And our patient has 2 damaged discs right above her fusion, L3-4 and L2-3. Now I'm not able to get the 3-4 needle in, but I'll get it in later. But we are able to get the 2-3 in. She's awake. How long have you had back pain for? 7 years. All right. Are you comfortable? Any pain right now? How bad is that on a scale of 1 to 10? How high does it go? 10? Is that where you get back pain? All right. Guess what? You get to go to sleep now. So L2-3 is 10/10 concordant, her typical pain. I couldn't get it L3-4 done, but we're going to fix it anyway. You could see the herniated disc. Show them the herniated disc, Jordan. You guys see the herniated disc at 2-3 where we did the discogram? The dye is coming around the disc there. Now,
Yes, we do.
Dr. Berndes made a great point. The foramen, show us the foramen where the nerve leaves. Circle the whole thing. It's that big white thing. Totally wide open. So that's why she doesn't have leg pain, because she has a big foramen. But she has back pain. We're going to fix that today. All right. Berndes, everything good? All right. I'm going to get started if that's okay with you, Dr. Berndes. Shot? All right, feel free to ask us questions as we work. We've already made our incision. It's 1/4 inch. You're okay. Shot? Everything's going well. You're doing great. Shot? All right, we are now inside the disc with the guide wire.
Sarah, can you come here real quick?
You need me to wait?
No, I'm fine. Just getting a lead fixed. So,
Little num-num? We're going to put some numbing medicine as we go down with the dilator just to make her more comfortable. This numbing medicine is shot, lidocaine, and marcaine. Shot. All right, looks good. Now, I don't want to inject any medicine in the foramen where the nerve is. Otherwise, she can get a weakness in her leg from the medicine. Shot. Any questions?
No current questions.
All right, great. Everything's going well for her at this point, and she's sleeping comfortably. Thought I could get it, but no. Right? There's just some calcified disc there. All right, have we shown our video on how the Duke laser disc repair works?
Not yet.
Let's do that for our audience.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Yes, welcome back, and now you understand how the Duke laser disc repair surgery actually works to go into an annular tear herniation where the pain comes from and to treat it with a laser to debride the tear. Feel free to ask questions during the surgery. Our patient won't mind, and I won't mind. I'm happy to try to answer them as best as I can. Right now we're going in with the scope, down the tube, and at the end of the tube we are inside that damaged disc, the one we were talking about. Remember, this was a 10 out of 10 pain. So this is causing her daily constant pain that she gets every day. We verified that during her surgery. All right, a little bit blurry. I'm going to sharpen it up, but you can see we are inside the L2-3 disc, the damaged disc, and it is damaged. Look at all the blue. That is herniated nuclear material. So we tested this disc with her awake, and she said, yes, it's 10 out of 10. It's my typical pain I get every day. I did not test the next disc down, 3-4, because I couldn't get the needle all the way in the disc. There's no point in testing if you can't get the needle in the disc, because you're not going to be pressurizing or filling the actual disc itself. The dye will just go into the epidural space, which is not a discogram. To do a discogram, you have to actually inject the disc itself. There's an old piece of herniation right there. All right, any questions from our audience yet? Look at that herniation, here it comes. The reason why the herniation is here, this is actually the herniation that was in the foramen. We saw it on the discogram. But when I put the metal tube in and the pipe in the dilator, it literally pushed this into the disc. This is all part of the Dr. Anthony Young's technique, which is inside out, that he taught me, okay, in Phoenix. This was his idea of, hey, let's start inside the disc where it's safer, where we can't damage anything like the nerve roots. So it's a safer way of doing the endoscopic transforaminal surgery by starting inside the disc that's injured. But it has the added benefit of actually shoving pieces of the herniation from the foramen where the nerves are into the disc, and then you take them out from there where it's safer to take them out. So I've prescribed to this technique for years. I think it's the best technique, the safest technique, the most effective. But it does require hammering that metal spike into the patient's disc, which you guys all see and don't like. So, but trust me, it's safer that way and more effective. If you don't do the inside out technique, you really can't do the Duke laser disc repair. Any questions from our audience?
No current questions.
Okay. Don't be afraid to ask questions, folks. We do take questions during the surgery, and I enjoy answering questions, engaging with the audience. Any type of, well, I think it's fair to call this manual labor, because I am using my hands, right? My manos and dedos. My manos and dedos, so it's manual and dedual labor. All right, that was supposed to be funny. At least Luis is laughing. So as I'm doing my manual labor here, I can use a distraction. And Luis is not my type. Just kidding. Luis cannot distract me that way. As a matter of fact, Luis does an amazing job of not distracting me, since we're on the subject, right? So if you have a really good scrub tech and assistant, then you don't get distracted, because they do everything right. Right, Luis?
Yes, sir.
It's only when he doesn't do his job right that I get distracted by him. And he doesn't distract me. He does a great job.
Thank you.
Best I've ever had.
Appreciate it.
Better than Augusto. I do miss Augusto. I hope he's well. Augusto,
The hippopotamus.
the hippopotamus son. We had some good times. Augusto was my physician assistant, my second physician assistant. If you want to know the history of Duke Spine, the first physician assistant I ever had was a PA/nurse practitioner, and his name was Roger. Roger was there from almost the beginning. 2004, when I first started working in Titusville at Parrish Medical Center as a neurosurgeon. I remember going to the emergency room on my first day of call, and I met a guy there who I liked. Turned out he was the PA, and he was also a nurse. So Roger and I got to talking, and I actually stole him from the hospital, which the hospital gave him up because they knew I needed help with being the on-call neurosurgeon. And Roger Reed and I worked closely together for many years until he left, went to Texas, and then disappeared. I never heard from him again. But I trained Roger. Have to say, I was disappointed with the way Roger left, and he left suddenly. So it is what it is. But it opened the door for me to hire Augusto. And I actually enjoyed working with Augusto more than I enjoyed working with Roger. And Roger I really enjoyed working with. Roger was amazing. I'll never forget one time I was so sick with stomach virus. Roger came over, started an IV on me at home. I couldn't even get out of bed. He was a friend. Anyway, I went from Roger Reed being my first physician assistant to Augusto being my second. Augusto, we recruited him from Palm Springs, California. He was working for an orthopedic group, orthopedic surgeons, and he wasn't happy because he told me he was not getting enough, not being able to do enough in the operating room. They were just using him to see patients in clinic. He wasn't operating enough. So I brought him and I basically made him my assistant, right, Luis? And he did a lot of operating. More than he's ever done. But there is of note, Augusto was actually an orthopedic surgeon by training in Argentina. But the problem is when these doctors come to the United States, they're not allowed to just become an orthopedic surgeon in the United States. They can only be a doctor, maybe. They have to go back to school and they have to retrain, start over. And it's very hard for them. So he became a physician assistant instead. But he had already been 20 years an orthopedic surgeon in Argentina, doing joints, knees, hips. So he was quite experienced, and I had to train him in spine. But I thought he did fantastic. So Augusto left, and I don't think we had anybody after that, right? Maybe we tried a few PAs, they just didn't work out. Right? I'm a very demanding boss. I demand that my employees do good work, and unfortunately, my standards are very high and not compatible with most other people's standards. And I don't tolerate poor performance. So I've never really been able to replace Augusto or Roger. All right, pretty much done here. That's it. And you're gonna see right here the nerve root is right up there. Look at the scar tissue on top of the nerve root right there. But I can't, let me have the laser one more time. I just want to get that last bit of annular tear. Just a tiny bit, that's all. Great job. So we're done with that disc. And that should fix her pain from that disc, the 10 out of 10 back pain. Okay, we're gonna irrigate it. Scope off. Nice job, everybody. Little antiseptic irrigation. And then we're gonna move on to the next disc.
Yes, sir. We're going to do CPAP. No problem.
What is it? Yeah, what is our next case anyway? Yeah, so the next patient does not want to be broadcast. So we won't be able to broadcast that to you guys. So you'll see this case, and then after this case, we're going to take a break for a few hours, and then we'll be back for one more at the end. All right, any...
Four-level case, right? Two levels and then
I have no idea. Any
Yes.
questions?
Yes, we have 2 questions as of now. This first one comes from Nick on Facebook,
All right.
and they said, "Hello, I only have leg symptoms down to the toes and fingers. It's only 6 months since my injury that caused a disc herniation. Is it a good idea to do the surgery, or is it better to wait a little bit?"
So Nick, great question. The answer is I don't know if it's better to do surgery or not based on what you're telling me. I would need to see you, Shot. I would need to do an exam by Zoom. I would need to see your MRI. I would need to ask questions, and we do all of that through a consultation. But just, hey, I have these symptoms and it's been 6 months since my injury, it's impossible for me to tell you what you should and shouldn't do. No surgeon in their right mind would do that, not even the bad ones. Yeah, you need an examination. I need to see your MRI, and then we can figure out what needs to be done. So feel free to use our free MRI review link. Thank you. Henry will post it, and you can go and submit your MRI for me to see, Shot, and then we'll go from there. Okay? Great question. Happy to help you. I just cannot answer something like that based on the amount of information you've given me. I'm not a magician. Shot? All right, so you can see we're coming down to the next disc, which is right above her fusion. And I wasn't able to access this disc before because it's too collapsed, and there's some calcification of the disc in the back here. So I needed to do my old trick, Shot, which is to use the guide wire to get down safely underneath the nerve root, and then to advance this thing while she's asleep. Shot? Oh. If you have questions, feel free to ask.
We have another question. This comes from T King 2520 on YouTube.
Hi, TK2420.
They
Welcome.
They asked, how long is the learning curve if other surgeons want to be trained?
How long is the learning curve?
If other surgeons want to be trained.
Oh, I heard you. Yeah,
Oh, okay,
I'm just
sorry.
repeating the question, but thank you. The learning curve, it depends. First of all, there's 3 parts to your spine. There's cervical, there's thoracic, and there's lumbar. Right now, we're doing lumbar. Shot? But if you wanted to do cervical, it would be additional time. If you want to do thoracic, it would be additional time. Lumbar is the easiest of all. And even then, it's not easy. Shot? Yeah, interesting. Phew. That was not easy. I wonder if we can do a discogram. I think you're rotated there a little bit. I'm going to try a discogram. I would say a year minimum to learn. A year is a safe number. It's not going in. I think the problem is it's jam-packed with disc material now. Try it. Great question. I would say a minimum of a year if you do enough cases. I don't know if it's the right hole. Is it? Right now we're cleaning out the center of the dilator. Try it. A little more. Yeah. I think it's just jammed up, right? So there's no way we're going to get to do a discogram. All right, I apologize. This disc was next to the fusion, and it was the worst shot. You see how it's off on orbit? I think she's moved a little bit. I think that's better. That's fine. Shot? All right, let's go ahead and do that. Well, we were able to get into the disc, but it wasn't easy. It took some patience and perseverance and a little bit of strategy. We should be done in 10 minutes, Doctor. A lot of arthritis. Go ahead.
This next question comes from Trust on YouTube.
Hi, Trust.
They asked, is the MRI review free for the knee if already it's free for the MRI on back?
Is the MRI review free for the knee? Yes. Yes, Trust. So let me explain what Trust is asking. Some people know that Duke Spine Institute now offers an alternative to a knee replacement, and a lot of people suffer with knee pain, and they're told they need a knee replacement. Well, it turns out there's a way to get rid of the knee pain without doing a knee replacement, and it's done with our plasma treatment, Duke plasma rhizotomy. And this is a 15-minute procedure that's outpatient. There's no hospital. There's no implants. There's no metal. There's no cutting your knee out with a saw like other doctors do for knee replacement. And more importantly, it actually works really well. And patients' pain goes away immediately. And we've done 10 patients with this new technology. 10 patients, we've had 0 complications. And all 10 patients, the knee pain went away completely. Now, there is some soreness that you're going to have in the knee from the surgery for a week. It's going to be a little sore. You'll have to use some ice. But every one of our patients came back to work that very next day. They didn't miss a single day of work. Jeez. Hold it. That's a little bone spur. So they didn't miss a single day of work, and they all had 100% of their knee pain went away with surgery, with the procedure. It's called the Duke plasma rhizotomy. Now, I personally, Dr. Duke Majan doesn't do the Duke plasma rhizotomy, but I am the pioneer who invented the technology. The person who does it here, we have 2 doctors. One is Dr. Patel, who I recommend first and foremost at this time. The other is Dr. Davis, who is an orthopedic surgeon. Now, Dr. Davis is new to our practice, but he's a phenomenal doctor. But my advice right now is Dr. Patel. He is the first surgeon here at Duke Spine to be doing it, and that's what I would recommend. Now, you don't need to do an actual MRI review because Dr. Patel can determine whether or not you're a candidate based on a report, an MRI report and some brief 5-minute questions on the phone. But you can also schedule an MRI review if you'd like to. So let's go ahead and I'm wondering if somebody's interested how they could do that. We haven't really set it up for that. Henry, any suggestions? Maybe maybe just give us the phone number of the person. Let me think.
If they put it down, I could take a picture of it, and when we come here for Q&A, I could just give you the number.
Yeah, I think what we need to do is get it over to Dr. Patel
Okay.
and have Dr. Patel reach out to this patient,
Okay.
this potential patient, to discuss the procedure. But basically, it's 3 little cuts, 2 above the knee, right, Luis, and 1 below? Luis has done those with Dr. Patel. He knows exactly what Dr. Patel does. And yeah, and then it's, like I said, outpatient. It takes a few minutes to do, 15 minutes to do. There's no bleeding, and the recovery is immediate. You'll be sore for a few days, but aside from that soreness, the pain in the knee should be gone. So, all right. This is the farthest back part of your of the disc. This is where we had all the problem getting into. You can see all the calcium. There's a little bit of fat there, but this is the last 3 minutes, doctor. 3 minutes. All right, I'm just about finished here. This is all that hard calcium, why we couldn't get in earlier. And now we're cleaning it all up with the laser. Remember, she didn't have much leg symptoms, right? She was all back pain, yeah. So we've gotten rid of the back pain source, which is the tear in the back of the disc. And now I'm just cleaning up some of the herniation and tear. But I will not gild the lily. Just pretty much done there. This last piece and I'm done. 1 minute. All right, type your questions for me, and I'll be happy to answer them. The reason we don't see blue is because we didn't put any blue dye on this disc. We did on the other. Grabber. I think we're done here, doctor. Yeah. Yeah, I don't see any more pieces. Looking good. She did great. There's the nerve root. Luis, let me just get this last little piece. Hold this right here. Wonderful. So even though she didn't have any leg symptoms, the nerve was getting pinched. That's it. Scope off. We are done. We've done 2 discs and 2 SI joints on her, the lady from Texas. And type your questions up. I'll be happy to answer them for you. What's wrong?
No, I still.
Oh, that's fine. She's snoozing, huh? She doing all right, Dr. Burndes? She's comfortable. Vitals are stable. We've just irrigated out the 3-4 disc. Good job, Luis. Oh, it's still clogged? I see it. Yeah, it's hard. Got a little bit of that calcified stuff in there. All right. That should be it. All done. Thank you. Any questions? Type them up. We had very little blood loss. And she's comfortably sleeping. Like I said, she told me she's watched 100 of my surgeries, so she knew exactly what we were doing today. And actually, you can see the Duke plasma rhizotomy for her SI joints. You all see this here? I mean, it was hard to see earlier. You guys see?
We can see
Henry?
it. Yep.
The little holes that are done?
Yes, we do.
And then of course, the 7mm cut for her 2 discs that we fixed with laser. That should fix her back pain here as well as above her fusion. I'm excited for her. All right, come and answer your questions. Type them up, please. And you can go ahead and leave the room. Henry, you can go to a nice testimonial from one of our patients. Good morning. It's February 22nd, 2023. I'm Dr. Duke Mage, and I'm here with one of my patients who traveled to Duke Spine Institute, not too far away from Jacksonville.
That's correct.
Yep.
That's where we're from.
You found out about Duke Spine through the internet.
Yes, I did.
And why did you end up coming here?
I ended up coming here because I could not get rid of the pain that I had in my back and in my leg. I tried to exercise. I tried every physical therapy, yoga, everything you could think of, and I just could not get out of it. It just would linger and linger and linger, and it wouldn't go away.
How long have you had that back pain for?
This back pain has lasted me for the last 6 years. It started when I was working at the garden stores, doing a lot of heavy lifting. I took some time off from it, and then I jumped back into work, and the pain, just when COVID hit, I just had gotten a job in the garden, took another job in the garden store, and shot down my leg, and it's been like that. The pain's been like that for 2 years. So, now it's 2023, and came here to see you, and yesterday we had it done, and in one day I'm doing a lot better now.
So you had the Duke laser disc repair done yesterday at L45, L5S1. You could see us in there with a tiny 7mm incision, the endoscope and the laser, cleaning out your disc. And clearly, to me, the disc did look injured, like they were about 5 to 10 years of injury. So it's been going on for a while for you. And you have degenerative disc disease. So a lot of people ask me, does the laser surgery work to get rid of back pain and leg pain when it's degenerative disc disease? What would you say? Sitting here now.
Yeah, I mean, my worry was that, the disc had gotten just so bad that it wasn't really replaceable, that, I was recommending a fusion. Mm-hmm. And I certainly did not want that. When the pain came on, I researched and found you and said, no, I don't have to do that. I don't want to have to do that. That's just not right.
Yeah, so you have degenerative disc disease at L45, L5S1, but you had back pain coming from them. We did the laser surgery. We didn't do fusion. Is your back pain still there?
No, it's gone. It's gone.
Yeah. And the pain in your right leg, down the back of your right leg, is that still there?
That's gone.
Gone. Now, is it gone because we put you on narcotic painkillers and you're loaded up on morphine right now?
Yep. No pain medicine, no anything.
So what did you take after the surgery? You took a Tylenol?
Tylenol.
Robaxin. And are you still taking them, or are you using them?
I took them this morning, in fact, so I didn't even take them right after. Went to dinner after this, and yesterday went to the hotel, slept real well, and got back up. And
so no narcotics. You've been up walking around.
Yeah,
the surgery was outpatient.
At 62, this is my time to really concentrate on my health and get back to the exercises and the walking I want to do, the swimming I want to do, the bicycle I want to do, the living, not the existing.
Exactly. Living, because you're not limited by pain anymore.
Yeah, and maybe, I was, a judge was good. We did disability over the phone because of COVID, and he awarded me that.
Congratulations.
And that was 2 years ago. But I don't want to depend upon the government. I want to go out and get working again.
You
So
may not need disability anymore. What do you think?
that's where I'm going.
I want to mention one more thing.
Sure.
You did have surgery already before you came to me.
And that's another thing.
You had laminectomy.
Yeah.
Did it work for you?
You know, I have to say, it may have worked only because my first surgery, and I stopped the work that I was doing at the Jacksonville Zoo and Gardens. I'm a horticulturist, so.
But if it worked,
But
you wouldn't be
be
here having
here
another surgery.
No.
So did
Because
it work for you? Did it take away your back pain?
No, it didn't. Not in the long run.
Did it
No,
take
because it
away your
weakened the
leg
spine.
pain down your leg?
No.
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 So the problem with laminectomy is people feel good maybe for a little while, a few
That's
months,
right.
maybe a year, but then because they've removed all the bones and ligaments
That's exactly-
from your spine, it causes things to get worse.
That's
and they're
what-
not addressing the disc. The disc is actually the cause of all the pain.
Right.
And they didn't fix your disc.
No, because when I had that surgery, I stopped the job I was doing, took time off, and went back to and boom, it went back in.
Okay, so as soon as you got active again, the pain came back.
That's right.
Yeah, that's the problem, is that you really just limited your activities rather than fixing the source of the pain. Laminectomy doesn't do that, doesn't fix the source of the pain. The Duke laser disc repair does. Well, congratulations. I'm
Great.
happy for you.
Great.
And I'm excited for you and the rest of
Sure.
your life. 62, you're going to start enjoying life and doing all the things you want to do. But remember to
Absolutely.
let it heal first, okay?
Yeah, we're gonna let it heal. And before I put that big heavy guitar on me, because I am a guitarist,
Of course, there you go.
So-
Anything you want to say to your musical fans out there?
just remember, keep on rocking in the free world. If you need some help, come to this man. He is amazing.
Yeah, we got a Leonard Skinner fan, right?
Yeah, I love the Southern rock.
All right, thank you. Good morning, I'm Dr. Duke Majan. It is March 1st, 2023. I'm here with a patient who traveled to Florida from Iowa. He has been suffering with back pain for years. He started to have leg symptoms in his left leg. That lasted for a few years. Then it switched to the right leg, right?
Correct, yep.
And you said, enough is enough, I need to get this fixed. And yesterday you had the Duke laser disc repair, which is the endoscopic surgery with the laser repairing the damaged discs in your back. And you're here today, less than 24 hours after surgery. How do you feel?
It's almost unbelievable. And I'm typically kind of a skeptical person. So it's like, okay, something doesn't seem quite right, because I have no pain. I took no pain medicine. You know, went from my left, which I had for multiple years, and then it went to my right and went down, made the outside of my calf numb. I can't wiggle my toes, and my foot wanted to roll. And we had the surgery, and I woke up and felt great. And you know, I got up in recovery and walked around, and I could already tell my foot wasn't wanting to flop and roll. Now I still have a, you know, and even on the left, I had some sensation here that's, you know,
Coming
that
back.
was kind of numbing, and it's starting to come back. Again, I'm skeptical. It's like, okay, how much is this as placebo? You know, because I was telling Dr. Duke that I don't get it, because, you know, he cut my back, he pounded a rod in there, did 4 different levels, and I have no pain. It's just incredible.
Yeah,
And
it is incredible. That's why we're trying to share these stories with the rest of the world, so people could stop living with the problem or stop having bad spine surgery elsewhere.
Yep. And I went back to the hotel and walked around the outside of the building probably 4 or 5 times. And typically I would start feeling some back tension then. Nothing.
Yeah, it's gone.
It's gone.
It will be gone for the rest of your life as long as you don't re-injure it. Let it heal. Yeah, he woke up yesterday and I came to visit him in the recovery area, and the first thing he said is, "This is amazing, but it must be the medicine, right?" And I said, "No, we haven't given you any medicine that would do that. The propofol we give, which is the sedative for the surgery, it's not a painkiller. It only puts you to sleep. So you'll still feel pain even with the propofol." Basically, the results are legitimate and genuine. And that's what our patients experience with this procedure.
It's amazing.
So what did the back pain and leg symptoms, how did it restrict your quality of life? Tell us a little bit about that.
Oh, you know, again, over the years, you know, it would kind of, I'd hurt and I'd have to lay down and not do much. And then here towards the end, I couldn't walk very well. I mean, and luckily my job is, you know, an IT job, so there's not a lot of walking. So I was still able to do my job fine, because if I would sit, it would be okay, not a lot of pain. But I couldn't walk, and the foot would flop when I'm trying to walk. It's just incredible.
Yeah, no, I appreciate that. And so it really had an impact on your work, but also your hobbies, I'm sure. It restricted your quality of life with your spouse who's here, and loyal wife who's here supporting you. I'm sure she suffered with you. I could see it on her face.
Yeah.
Right?
Yep.
It's hard on people when you have a medical problem that you can't find an answer to. Now, were you offered other surgeries for your back?
Oh, yeah, I guess, I did some research. I actually went to, and I probably can't name them here, but I went to 3 different spine surgeons before I talked to you. And 2 of them recommended a 3 or 4 level fusion, and 1 of them recommended that I don't think we can do anything for you, so I wouldn't do anything.
And that's a problem, right?
Oh, yeah.
Because that's not accurate.
I'm convinced that if I wouldn't have done something, I wouldn't be able to walk very well at all, you know, in a pretty short order of time.
Yeah, you would be wheelchair bound. There's no doubt about it. So isn't it surprising that here that there are doctors who cannot figure out what's wrong?
Yeah, I don't understand.
Well, I've had many network administrators and IT people working for me over the years, and I've seen many of them that can't figure out what's wrong. And many of them that do bad patch jobs, right? Same thing with back surgery. You're gonna have doctors who don't know what to do at all and throw their hands up and say, live with it or go to pain management. You're gonna have those doctors who think they can fix it and will give you the type of treatments that really are not good treatments. They don't last or they don't work properly. And then you have, once in a while, you find someone who really understands what they're doing and can give you the very best solution in the world. And I know I would pay anything for that myself. I would just ask, how do you feel today? And is there anything you want to tell the rest of the world out there?
I feel great today, and you know, one of the things I've always said is, as you go through your working career, you know, I've worked with a lot of people that said, when I retire, I'm going to go do this, I'm going to go do that, and something happens, and they don't get to do the things they dreamed about doing. I feel like I'm going to be able to do the things that I want to do.
Yes, you are.
So I would say anybody that's having back problems, you know, come see Dr. Duke.
Well, thank you
For
very
sure.
much. I appreciate that. It's great helping you and your family. Take
Thank you.
care. And don't do too much too
I won't.
soon. All right. I'm Dr. Ari Duke-Majan at the Duke Spine Institute, here with a patient from Virginia who came out to the Duke Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I feel, my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months, and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live, because I knew every day waking up it could happen today.
Yeah, there's no way to live, because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery it's like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's going to work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Duke here. And I started watching his videos and testimonials, made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs, and within 2 days I did my virtual consultation with you, and 10 days later I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
And yes, I'm done now. It's just, I'm back to recovery, you know.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to two things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's two surgeries that work, fusion and the Duke laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain, pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually one or two Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Duke any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. Good morning, I'm Dr. Duke Machen. I'm here with a patient who traveled from California to Duke Spine Institute here in Florida for back pain that he's been suffering with for about 7 years.
Yes.
He's a father and he takes care of his family. It's been really hard for him to do so. He's actually gone for surgery already in the past. I think you had 5 surgeries done.
Yes, I have 5.
And that was done at elsewhere. We won't mention. You can say the name. Go ahead. Tell us your story. We want to hear it.
So I'll say this quickly if I can. So I come from San Jose, California. I had several procedures in the beginning of the year by the Bonati Spine Institute here in Florida.
With the hope that it would get rid of your back pain.
And it did not.
It did not.
Everything they said they were going to do, they did the opposite. If anything, it left me more physical and I want to say mental pain.
Horrible back pain.
Very. It's an understatement.
And you have a child that relies on you. You have a family that relies on you to be healthy.
Absolutely. I have a 19-year-old autistic child that me and my wife take care of. And I mean, I can go on and hours about that, and it requires my help. If not greater part of the day, I'm also a business owner of a painting company in San Jose, which my employees rely on me. So long story short to all that, a lot of people rely on me. If I cannot even stand or sit up for any time of the day, I feel useless. Stabbing pain in my back, my lower back, my buttocks to my legs, it was just there constantly. I had my surgery done yesterday. Dr. Duke here. took it away. It's gone. I feel a little bit of my surgery stuff, but other than that, I don't even really feel that, to be honest with you. I don't. I'm able to sit up straight. I'm not trying to compensate what side of my body to sit on. I'm actually sitting straight. So.
How does it feel to know that that pain you lived with for 7 years, that's hounded you for 7 years in your back? How does it feel to know it's gone now?
It feels fantastic. It feels great. It feels like a little too good to be true, but it's gone. It's literally gone. I have to learn how to feel good again and just take it step by step.
Now, when people get open back surgery, doctors put them on narcotic painkillers, opioids. Are you on any opioids from us?
No, none.
You took Tylenol maybe last night? And
I didn't even take that, and didn't need to take that.
So basically no painkillers?
None, no painkillers.
Because this incision is just 7 millimeters. You can see in his surgery, we made a tiny little cut on his back, and we showed his scars from the other surgeries he's had elsewhere that he mentioned, and there's all these scars on his back. And all those scars and all that surgery, what did it do for you at the Bonatti?
It made me not believe in any doctors. It made me scared. It really did. I come from a background that, when you shake someone's hand and you look them in the eye, they say, we're going to take care of you. That's what I do. I'm in a service business. So when I tell somebody not to worry, I got you, I mean that. So when Dr. Duke said not to worry, we're going to take care of this, I was kind of a little bit okay. I wasn't overly excited because I didn't want to overexcite myself. I wanted to see what happened. But right now, I'm literally jumping inside. I'm jumping, yes. So I'm very happy and very thrilled.
I'm so happy that you're doing well and that we've made a big difference in your life and the life of your family. I met your mother. Yes. She's very sweet. She's here to help take care of you. Anything you want to tell your family or friends out there that are going to watch your video and your experience here at Duke Spine?
I would like to say, and if I can say this, I know there's a lot of testimonials, but if you have any problems, if you really do, come here. Come to Duke Spine Institute. They'll take care of you from the first phone call to setting up the initial timing of having Dr. Duke look at the imaging and your report. Come over and get it done. Have him take a look at it. He gives you a no BS type attitude, straightforward. And if he's going to help you, he's going to help you. And you're not alone after that as well. I feel very welcomed here. Even though I live in California, I'm not being rushed to go back home. From the staff here, from the front office telling me hello and whatnot, I'm very welcomed here. And I feel that I have a spine doctor for life. If need be, if I need to come back again for anything else.
And I don't think you're going to need to come back. And one thing that I want to emphasize is the other surgeries you had done at the Bonatti. It's not that the Bonatti is a bad place in any way, in my opinion. They just did the old-fashioned laminectomy, microdiscectomy. And the problem is that surgery doesn't address the pathology, what's causing people's back pain. Because the problem that's causing your pain is the disc. And they're coming from the back, removing bones and ligaments in the back of the spine. They're not getting up to clean the tear in the disc. You got to do the annular debridement, folks, if you want to get rid of back pain. And laminectomies and microdiscectomies, they don't do that. So that's why people have such bad experiences with those types of procedures. It's not necessarily the doctor, it's the procedure that's bad. The problem is the doctors are recommending that to patients. There's a far better new technology now, the Duke laser disc repair. Would you agree?
Absolutely, 1000%, absolutely. Thank you again, Dr. Duke.
You're welcome.
Thank you, sir.
My pleasure.
Thank you, sir.
You're welcome.
Thank you.
You're welcome.
Yes, sir.
That's why we're here.
Thank you.
All right. Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone.
All right, I'm back here with you, Dr. Dumajan. I was just in the operating room. I had to go check on my post-op patients. They were doing good. And now I'm here to answer your questions. So let's start with the questions.
First one comes from, I love this name, Spyros.
Spiros, either way.
Spiros, I think.
Either way, great name. And they ask, how long does it take for the annulus to heal? The larger the tear, the longer, or is there a limit?
Yes, Spiros. So the annular tear will never heal unless we do the laser surgery that you just saw. The tears don't heal on their own, but I assume what you're asking me is how long will the annular tear take to heal after the Duke laser disc repair surgery? If that's the case, it'll take a year. I tell everybody a year. Within a year, that tear should be completely healed.
Next question comes from Nick, once more on Facebook.
Hi, Nick. Facebook.
They ask, as a neurosurgeon, what is your opinion for nerve damage? Can a nerve heal?
So, thank you, Nick. There's two types of nerves. There's the nerves that are located in what's called the central nervous system, which is the brain and the spinal cord. Then there's the peripheral nervous system, which is nerves outside of the brain and spinal cord. And it's an important distinction because nerves inside the brain and spinal cord, they don't heal, which is why people who are paralyzed in the spinal cord, they don't ever get better. People that have strokes and have nerve damage in the brain, they get better, but there's a limit. You can't repair the nerves. However, peripheral nerves, nerves outside of the spinal cord and brain, they do heal. And the healing depends on whether the sheath, this tube of connective tissue around the nerve that supports the nerves, whether that sheath is intact or it's been cut or transected. So if the sheath has been cut or transected, then the nerve won't heal unless you sew the sheath back together. And that's what some neurosurgeons do. We get in with the microscope and we sew that sheath back together so the nerve can grow back, okay? If the sheath has been crushed and it's still there intact and the nerves are crushed inside the sheath, then they can also grow back, usually. There will be some scar tissue that will block it, but you can get restoration of nerve function inside the distribution of that nerve over time as the nerve heals. Remember, some of the crush will cause scarring and prevent the nerves from healing properly, but a large number of the nerves will grow back and start working. So it all depends. How long it will take for a nerve to heal depends if it's central or if it's peripheral. Central doesn't heal, and it depends if the nerve is transected or crushed. Yeah, I think that summarizes it.
Next question comes from Trust once more on YouTube. And they ask, is this new knee procedure covered under insurance at this time?
Is the new knee procedure covered under insurance? The new knee procedure is the Duke plasmarizotomy. Is it covered under insurance at this time? It depends on the insurance. I would say that most commercial insurances may not cover it, and they may say that it's too new, they won't cover it. Medicare, I don't think will cover it just yet, and there are some insurances that will. So it really depends on your insurance. But that said, I would get it done even if your insurance doesn't cover it. It's not that expensive. It's not as expensive as fixing your spine, for example. And think about how much better off you're going to be if you don't have that knee pain. Even if you got rid of 80% of the knee pain and you're able to function. And by the way, the recovery is immediate, so you can go back to work the next day. So imagine getting rid of your knee pain that will never go away otherwise without having to have major surgery. Now, the other problem with major surgery, which may be covered by your insurance, is that you're going to be out of commission for a year with that knee surgery, the knee replacement, okay? That's a year if things go well. A lot of people with knee replacements take a year to fully recover, okay? That's the average. With the Duke plasmarizotomy, you're talking about full recovery in a week or two. So, big difference. And during that year that you're recovering and you're not working or playing or enjoying life, that's a year of your life you've lost. Whereas with the Duke plasmarizotomy knee procedure, you're not losing a year of your life. You may lose a week of your life at most. And even then, you're back to work and doing normal stuff. You have some soreness during that week. So you're getting an entire year or more of your life back, and you're improving the quality of your life immediately. Okay? Plus, you're getting off pain pills. If you're taking pain pills for your knee, it's worth it. Get it done. Don't worry about the cost. Save the money and get it done. Also, with knee replacements and major surgeries, you have complications that happen. I can't even begin to tell you how many complications. An infected knee or a fracture of the bone and implant interface, loosening of where the implant goes in. And then of course you've got leg length discrepancies which occur as a result of not measuring properly for the knee replacement, where one leg becomes longer than the other, and then you've got hip pain and back pain as a result of that. So having open knee surgery is a nightmare. The Duke plasma rhizotomy is worth it. Absolutely worth it. Even if your insurance doesn't pay for it. It's all about quality of life and safety and effectiveness.
Next question comes from Jasperic on YouTube. I mean, like they say they do have a question, but they haven't asked it. It was about foot drop, but if they will ask it, we'll come back to it. But until then.
So Jasper, question about foot drop. Not sure what it is,
Yeah.
but going back to the nerves healing, as long as the nerve is unpinched, it may take a year to fully heal. If the nerve is not unpinched, then it could take longer.
And then we'll come back to Jasper if he wants to ask his question or ask their question. And next one is from Rick on YouTube, and they asked, Dr. Duke, what are some reasons to have a spinal fusion?
So Rick, what are some reasons to have a spinal fusion? Great question. So for example, if you have a motor vehicle accident and your spine fractures, right, literally breaks in half, the laser surgery is not an appropriate treatment. You need a fusion done. You need a reduction where they bring the spine back together, and then you need to fuse it, okay? Another example is there's a disease called ankylosing spondylitis. It's where the spine fuses on its own. It's a horrible condition. People have a stiff back and neck, but if they fall, they can literally fracture their spine. So that's another condition you're going to want to have a fusion. These are rare situations. So basically, traumatic fracture dislocation of the spine would be a reason to have a fusion. Another reason would be tumor of your spine. Let's say you have a metastatic lesion like cancer from your lung, it goes to your spine, or from your kidney, it goes to your spine, etc. And it's eating away at your spine. And then your spine just falls apart. You need a fusion to fuse that. So tumor spine surgery, fracture dislocations from trauma, and then finally infections like tuberculosis, very common in other countries like India, Pakistan, tons of tuberculosis of the spine. And if the tuberculosis gets on your spine, it'll start eating your spine, and then your spine falls apart. You need a fusion. So there's still a need for spinal fusion, but what I'm talking about, folks, is not tumors, infections, and high-speed motor vehicle accident fracture spine. I'm talking about degenerative conditions like herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, degenerative disc, spondylosis, stenosis, a little bit of scoliosis, some facet arthropathy. All these degenerative joint problems in the spine that are not trauma, tumor, or infection related are perfect for the laser surgery and the Duke plasma rhizotomy. There's no need to do fusions. And by the way, degenerative condition spine, which don't need fusion or artificial disc anymore, they account for 98% of spine surgeries being done. 98% of spinal fusions being done are due to these degenerative conditions.
And then lastly, we have a question from Trust once more on YouTube asking, is balance problems and or falling down a symptom of lumbar herniated disc?
Is balance problems or falling down a symptom of lumbar disc herniation? The answer is typically not. Balance problems are typically due to pinched spinal cord in the neck or thoracic, or problem with the brain, or the vestibular apparatus, which is what keeps your balance. Lumbar disc herniations typically cause weakness in the leg, numbness in your skin, and sometimes like pins and needles going down your leg, like your leg fell asleep. But most commonly, lumbar pinched nerves are weakness in the leg and numbness in the leg. Okay, sometimes sciatica. We call things like neurogenic claudication, which is your leg feels heavy and tired when you're walking, and standing gets better when you're sitting. So neurogenic claudication, weakness, numbness, basically, tingling, those are the symptoms of a herniated disc that's pinched nerve in the lumbar. Now remember, if you have a herniated disc, you could also have inflammation. So not just a pinching of the nerve, but an irritation of the nerve by the inflammation. If the inflammation is irritating the nerve, you're going to have sciatic pain shooting down your leg, or back pain. Okay? All right, thanks for joining us. This next patient we're doing, he does not want to broadcast at all. So we will not be broadcasting. That's his wishes. And we're going to record the surgery, of course, but we won't broadcast. So we'll be back for our last surgery in about 2 hours, hour and a half, 2 hours. And that patient is actually going to have a bilateral L5-S1 DLDR for herniated disc at 5-1 on both sides. And he's having 2 thoracic discs fixed at the same time. So we're doing a bilateral L5-S1 and then like a T9, 10, 10, 11, I think, thoracic disc herniation. So we will be broadcasting him. And he comes from overseas. I think he comes from Puerto Rico or something.
I think so.
Yeah. But he's an interesting one.
You're right. Yep.
Yeah, Puerto Rico. He's our last case. He actually came here a year ago because he went to another spine center in Virginia, and they caused an infection during his back surgery in his disc. So he came here, we cleaned up his infection, put antibiotics. That pain is now gone, the infection's gone, but he needed a few more discs fixed, and we weren't going to do it while he had an infection. So we postponed the surgery until now, when he's cleaned up and there's no more infection. So that'll be our last case. Thanks for joining us. Have a great afternoon.